everyone, I am Steve the Hurricane, and I am bringing you this public service announcement to tell you about my excitement for the recent announcement of the University of Harvard Medical Center's independent study that they're doing with ClearCare and Right at Home on reducing hospitalizations. I don't know if you're aware of this or not, but this is probably the biggest thing to happen for the private duty, non-medical home care industry since its incarnation 20, 30 years ago, all right? Right now, as it stands, the national average for a readmission between all skilled nursing facilities and all hospitals and LTACs and rehab centers across the nation, it's about 19%. What does that mean? That means that for 19% of the people who go to the hospital for anything over the age of 65, we're talking about Medicare beneficiaries. Essentially, 1 out of every 5 will be readmitted to the hospital within 30 days. Now, it's not a failure, because a lot of people say, well, that's a failure, we have to improve, and so on. From a government standpoint, from a financial standpoint, the government views an 81% success rate as a positive outcome. So that means they're really not going to put much more money into funding those Medicare-supported services like the home health and the equipment and everything else, because what they're doing essentially works. What this study is going to do is to have a true national statistic as to what the outcome is for somebody who gets custodial care versus somebody who doesn't get the custodial care. Obviously, Right at Home is a non-medical private pay home care company, and so their clients are paying fee for service. ClearCare is the software that people are using, so they're keeping accurate statistics on this. This Harvard University Medical Center independent research study is going to take a look at all of the data from 2015 through 2017, compile it to prove what we all suspect. I'm going to guesstimate based on my clients that I work with, it's going to be about a 5% readmission rate. But they're going to have an actual national statistic based on hundreds of locations throughout the United States and many markets from East Coast to West Coast and everywhere in between, so that we now have a true, accurate national statistic for the private duty industry. Now, what can we do with this? This gives us leverage. This gives us lobbying power to sit down with Congress and all the decision makers and lawmakers in Washington and say, hey, the statistics prove that this is the way to go. Right now, especially with all the labor law changes and all the things that are going on in the country, everything is getting moved towards institutionalization. If you don't have money, you go to a nursing home. If you do have money, you go to an assisted living, or you pay privately to be in an enhanced assisted living, which is basically like a nursing home that you pay a lot of money to go to, and you get all the services that you need. When this information comes out and it can actually prove, hey, home care is where people want to be. Hey, home care actually reduces the hospitalization so significantly that we should put more money and funding into this. It could help to defray the cost. It could help to get more government programs in place, make Medicaid a better viable source of revenue for all the agencies, and so on. So this information, when 2017 comes around and it's compiled, we can take that 2018, 2019 and make the future of home care, the future of healthcare, 2020 and beyond, a place where people can age in place, in home, where they want to be, with dignity and grace. So I am so excited to see this. Kudos to you, Right at Home. Kudos to you, ClearCare, for doing this. Harvard University Medical Center, thank you for doing this research. We appreciate it. We thank you for it. Share this message with every home care company out there. This is vital to the success of our industry. Thank you. God bless, and keep doing a fantastic job, everyone.